Hi, this is Dr. Casey, the longevity doctor. The first in a series of videos that I'm doing every Friday night at 6 o'clock Pacific time. And we're going to be talking about the strategies that we're going to be doing in the Women Defying Aging group that's starting in September. Every week in the group, we're going to address a different strategy. And on Friday nights, I'm going to answer some questions about these things and maybe talk about some myths or some problems. So tonight we're starting with mindset because I actually consider it to be the most important thing. In all my years of practicing medicine, I looked at the patients who got well, and so much of it had to do with what I'm calling mindset. I mean, what is mindset? It's how we think, basically, the set of beliefs that we have. So what does mindset have to do with health and longevity? Well, I'm going to ask you some questions. Do you see yourself as a victim or as a victor? Because that has a lot to do with whether you're going to heal or not, because there really isn't anybody to fix you. And it doesn't feel good to be in that victim mode. So another question, do you see your body as your enemy or your friend? Because that's one of the things that I worked with people on. I know I was raised to think my body was my enemy because I was sick all the time from early childhood up to, I don't know, when I was about 30, maybe. I had a lot of illnesses, and because I was not taught otherwise, I was like, my body is my enemy. So sometimes we just have to learn that our body is not out to get us. So another question you might ask yourself about mindset is, do you believe that you are helpless without the intervention of medicine? Or that you have an innate capacity of healing inside you? Because again, this is another way of seeing ourselves as a victim, that we can't get well unless something or somebody out there fixes us. So these are some questions to look at when it comes to the concept of longevity and aging. So let's look at the current mindset around aging. It's pretty much a cultural belief that aging is inevitable. You see it everywhere. I hear it from my friends. Well, I'm older now, and fill in the blank. We have all these beliefs that, it's just common knowledge in our culture, I think, that as we get older, we are going to deteriorate. And that belief permeates everything, everywhere you look, whether it's TV or the media or even your doctor. Even in my 50s, I have heard a doctor say, well, you're getting older now. What do you expect? Well, what I expect when I get older is to get healthier every day of my life. I have seen my patients do that. I know that it is possible to get healthier because as we get older, we understand our bodies better, what they need, how to keep it going. I'm not saying we don't sometimes need help. I just came from the physical therapist today. So, but again, coming down to mindset, that's really a key place to start. Do you believe that you are going downhill until the day you die and there's nothing you can do about it? Because I say that's not true. And I believe that women can defy aging. Some of the other things we're going to talk about in the first week are things like, and these are things that they have actually done research and found contributes to longevity. And much of this comes from genetic research. But one of the things that has been found is to be a lifelong learner. And so you probably hear some people just, they retire and then they give up, or at any age. I mean, I think we can start aging. If we buy into the cultural belief, we can start aging when we're 30. And our culture loves the youthfulness. So we need to keep going and understanding that keeping an open mind and continuing to learn, continuing to read, it stimulates our brain activity. And some people worry about what's going to happen to my brain when I get older. Well, just, use it or lose it. So that's another thing really that I put in there with mindset. The other thing we will be talking about the first week is things like addictions and what are you doing that's harming you. It's been said that the probably 3 worst things we could have in our life or that we could ingest are sugar, alcohol, and cigarettes. Those are all things that are addictions. But just looking at the concept of addictions. So what else are we going to talk about? So that's kind of the first week. There are a few other things that we'll be covering. The first week's going to have a lot in it. Week 2 is going to be about having a life purpose or a reason to live. That has definitely been shown to correlate with the longevity research that's coming out. And it's the thing that when I look in my medical practice, the people that got well were those who had a life purpose. So we're going to be working with that. Week 3 is going to be nutrition and everything around eating. Something that they have found to contribute to longevity is to maintain a lean body weight. I know a lot of people think, especially women, say, well, I'm getting older, I can't lose weight. And that's a problem that a lot of women have. So we're going to look at our physiology and what we can do to eat so that it turns on the longevity gene. So that's going to be week 3. Week 4, we're going to talk about fasting. My favorite technique for health and longevity because it works. And so we're going to talk about, we probably will do some fasting and we're going to, talk about it. And again, these weeks, I'm going to, on Friday nights, be addressing every one of these issues also. Week 5 in the group and in my Friday night talks is going to be around movement. My favorite thing is Neikong or Qigong, however you want to look at it. It's a Taoist Chinese set of exercises that's done for longevity. But the truth is, it should be no surprise that exercise is good for us. I've stopped using the word exercise because for me, it's almost like a school term, right? We're doing these exercises on history, whatever. Exercise sounds like something I have to do. Movement feels like something I get to do. So we're going to talk about movement in various forms of exercise, if you will. Another thing that we're going to cover is the concept of reducing stress. Again, big surprise, stress hurts us, stress ages us. So we are going to be talking about some strategies to deal with stress. And the thing that I love about the group is that not only are we learning and dealing with these strategies, but I do it in a group form because women supporting women is really so valuable. I mean, I know for me, man, I need support when I'm trying to do something to help myself. Support is so valuable, and that's why I'm going to do this in a group form. The group will be a 6-week online group called Women Defying Aging. So it's for women over 40 to begin to stop the aging process, ultimately, hopefully, reverse the aging process, because that can be done as well. So if you have any interest in it, would like to talk to me about the group, please send me a DM and I will be happy to set up a time to talk to you. Meanwhile, have a fabulous weekend and I will see you next Friday.